Understanding dental implants. How are they placed? Dental implants are a well-known choice for replacing lost teeth and also restoring the smile of a person. How exactly are dental implants made? In this short video, we'll discuss how to get dental implants and the outcomes potential patients should expect from the process. 1. Consultation and evaluation. The first step for getting dental implants is to set up the appointment with a dentist or an oral surgeon that specializes in dental implants. At the initial consultation, dentists will examine the health of the patient's mouth and determine if the patient is an ideal candidate for dental implants. The factors like dental health, bone density, and general oral hygiene are assessed. 2. Treatment planning. When it is determined to be an appropriate patient for dental implants and the dentist has developed the treatment plan specifically tailored to each patient's specific needs. The treatment plan will detail the required number of implants as well as the place of the implants and any other procedures that could need to be completed before the implants can be put in. 3. Implant placement. The procedure of putting in dental implants can be described as a surgical process that generally takes place with local anesthesia. Dental professionals will create an incision through the gums to expose the jawbone. This is in which the implant is installed. A small cut is made into the jawbone. Then, the implant is placed through the bone. The gum tissue is put back together, as well as a temporary cap can be placed over the implant. 4. Osseointegration. When the implant is implanted, a process known as osteointegration takes place. This is the process whereby implants fuse with surrounding bone tissue, forming solid foundations for permanent dental restoration. It can take several months to finish. During this time, the patient might be provided with an in-place dental restoration. 5. Abutment placement. When osseointegration has taken place after osseointegration has occurred, the next stage in the procedure of putting in a dental implant is the placement of the abutment. This is a small connective piece which is attached to upper part of the implant. It is used as the basis of the final restoration. The abutment is usually used in a follow-up surgical procedure in which the gum tissue opens so that the implant can be exposed. 6. Restoration. The final stage of the procedure of dental implants is attaching the dental crown to the abutment. It could include a bridge, crown, or a denture, depending on the quantity of missing teeth as well as the individual needs of the patient. It is made to fit the shade, size, and contour of a patient's teeth. It gives an extremely attractive and practical smile. The bottom line is that dental implants provide a high-quality and durable option for replacing missing teeth. If you follow the procedure step by step as described previously, patients are able to have a completely restored smile that functions and looks as natural teeth. If you're thinking about implant dentistry, you should be sure to talk with a dentist that is qualified who will provide individualized treatment and assistance throughout the process. Experience that they experienced. To conclude, Turkey has become a center for low-cost dental tourism due to its top-of-the-line dentistry, low-cost rates, modern services, tourist opportunities easily accessible, a friendly bilingual staff, and favorable feedback. Patients looking for dental treatments but feel intimidated by the pricey prices from their countries of origin should look into Turkey as a feasible alternative. The world's best clinics as well as skilled dentists and unbeatable hospitality experience, Turkey is truly a popular destination in terms of dental tourism.